Okay, good morning. In the last class, we are discussing about the clinical approach towards a child with the vomiting. So we will continue the same today. Uh, so today we will going to discuss some of the very common causes of vomiting, especially in children. Okay. So if you see in the neonate, the most common cause is overfeeding. Okay. So overfeeding is one of the most common as vomiting or maybe regurgitation. The reason is the capacity of the newborn stomach is about 30 to 40 ml at the time of the birth. So you cannot feed more than 30 to 40 ml at a time in a newborn baby. Okay, if you feed more than that, definitely it will be overflow and it is considered as overfeeding and baby may go for vomiting. So this is the most common cause. Neonates with the overfeeding, usually there will be vomiting. Then irregular feeding is also one of the cause. Okay, that means only you are giving fore milk and not giving the hind milk and the mid milk. So or irregular timings or sometime maybe the irregular faulty way of feeding. So these are some of the very common causes of vomiting in the newborn period, or especially in the neonates. Okay, now in the neonate, some of the gastrointestinal causes which are very commonly seen as a cause of vomiting are, as I told in the last class, swallowed maternal blood. Okay, so during the time of the delivery, baby may swallow some amount of the maternal blood and which may be get omitted after the birth, and that is called as maternal blood. So that may be omitted. So this is one of the most common cause of blood vomiting in children. Second is even in the postnatal period also, sometimes baby may omit the blood. That means when it is possible, yes, if the mother is suffering from cracked nipples, okay, through the cracked nipples when the baby is sucking, some amount of the blood may also go inside, and when the baby is vomiting, this blood may also come out. So this may create some confusion. Okay, if immediately after birth everybody knows it may be swallowed maternal blood, but after 10 or 15 days if it is happening, yes, the most common cause is cracked nipples. Mother is feeding the baby with the cracked nipples. So through the cracked nipples, when the baby is sucking, some amount of the blood is also swallowed inside, and that may be get vomited. Then faulty feeding habits is the most common cause of vomiting. We know that GR, gastroesophageal reflux. We know that the cardiac sphincter is a physiological sphincter. Actually, there is no structurally the smooth muscles are there. The upper part of the stomach itself is get modified into a sphincter-like position portion. Okay, whereas in the pyloric sphincter, actually it is an anatomical sphincter, and there is muscles are there. The same arrangement is not there in the cardiac sphincter. So therefore, it is always subjected to sensitivity. Okay, so high chance of irritation will be there, or with a minimum stimulus also it is get open up. Okay, so GER, gastroesophageal reflux, one of the most common cause. Then some of the gastrointestinal anomalies may be duodenal atresia, biliary atresia, and so many other conditions, or even the congenital pyloric stenosis. So that may be leads to vomiting. That will lead to vomiting, not maybe, that will lead to vomiting. Okay, then atresia, as I told, then stenosis. Okay, then sometimes malrotation of the intestine, or sometimes valvulus like conditions. So these may lead to vomiting in the newborn baby, because this is quite common in the newborn period. Then some of the other causes, if you see, infections, yes, child with the neonatal hepatitis, so may have vomiting also. Or birth asphyxia, yes, there may be vomiting. Okay, hydrocephalus, there may be vomiting because of increased intracranial pressure. Okay, inborn errors of metabolism, IEM, inborn errors of metabolism may also lead to vomiting. So, but this vomiting usually start 3 or 4 days after the birth, not immediately after the birth. Okay. So these are the most common causes of vomiting when you look into the newborn period. But in the infants, okay, 1 month to 1 year, what are the most common causes of vomiting? In the newborn, in the infantile period, gastrointestinal causes like gastroesophageal reflux. This is most common cause. Okay, gastroesophageal reflux is the most common cause of vomiting in the infancy period also. Then comes the faulty feeding habits, because in the infantile period, baby was given with the mother's milk exclusive for 6 months. So definitely the faulty feeding habits is one of the important cause. Congenital hypertrophic pyloric stenosis. So that is one more important issue. We know that. Okay, that is one of the cause of vomiting. Okay, there will be a projectile vomiting, will be there. Visible peristalsis will be there. Okay, then intussusception. Yes, intussusception is one of the cause for the vomiting, and in the rectal area there is rectal bleeding. Okay, through the anus there will be bleeding, and through the mouth there will be vomiting. So this is very important. That is blood with the blood in the stool and as well as vomiting. So that's intussusception. Okay, usually intussusception is very common during the weaning period. Intussusception is not so common in the early part of the life. During the weaning period, when you start introducing the external food, okay, supplementary food, so that time as intestine is receiving the heavy foods or solid food for the first time, so intestine may get stuck into inside one inside another. Okay, the loops maybe get stuck inside. So therefore during the weaning period, whenever the baby has got this problem, so you need to think about that. Okay, rotavirus, previously the rotavirus vaccine is also associated with the intussusception, like that reports were coming, and now it is not a big issue. Anyway, previously it was there. Okay, intussusception. Intussusception is one of the most common cause, especially in the normal kids. We have to look into the weaning period. During the weaning period, this is one of the most common cause. Okay, then peritonitis. Okay, so this is also the cause of vomiting. Then malrotation and volvulus in the infantile period. Some other common causes of vomiting in the infancy period is CNS infection. Any infection of the CNS, we know that CNS infection, meningitis, encephalitis, whatever may be. So there will be increased intracranial pressure and there will be always vomiting. A space occupying lesion, that is any tumor which is developing inside the brain. Of course, quite rare in the children, but may happen sometime. Then hydrocephalus, has to be seen because head circumference has to be seen in every child. Therefore, this is very important. A slowly developing hydrocephalus may lead to, see, when hydrocephalus is fastly developing, everybody will go into observe. But a slowly developing hydrocephalus of what you say communicative type, okay, communicating type. So that is very difficult to identify because if pediatrician is looking at the baby every day, he can appreciate. Otherwise, only mother has to appreciate this. Okay, quite difficult. So once in a while they come to us, and we may fail to diagnose the head circumference increasing unless and until we make a habit of taking head circumference with each visit and record it. Okay, so hydrocephalus usually one of the most common cause of vomiting because it's nothing but increasing intracranial pressure. Then in rare conditions where uremia may be there, okay, if the child with some of the renal anomalies is there and renal system is going to fail and failure of the renal system is there may be uremias, or sometimes some inborn errors of metabolism. Okay, so these are some of the causes. Again, the faulty feeding and overfeeding, this is also one of the most common cause. Okay, now come to the young infant. When you look into young infant, what is the most common cause of vomiting? Okay, in the young infant, again, young infant means 2 months, 3 months, like that. Okay, so intestinal obstruction may be one of the cause. Okay, then a child who came around the 1 week of life, suppose a child is coming to at 1 week of the life and the complaint of the child is vomiting, okay, and child is also looking dull and child is also not feeding well. These are the complaints of the mother. Okay, child is vomiting and looking dull and also not feeding well, and child is also dehydrated. Okay, now this is very important. See, child is also dehydrated, then please look into the genitals. Okay, why I'm telling is a child who is come around 1 week of life, first week of life, complaints of the child is vomiting, child is also looking well, that means child is looking dull, and child is also not feeding well, and child is also not feeding well. Okay, and child is also dehydrated, suppose. So then now we have to please look into the genitals. Why I'm telling is congenital adrenal hyperplasia. Okay, congenital adrenal hyperplasia, we have covered all this in differential sexual development. Okay, congenital adrenal hypoplasia, this is one of the leading cause of adrenal insufficiency, and that may lead to this type of presentation. Now if you look into adrenal deficiency, a child is 6 to 8 weeks old, suppose, and comes with the vomiting, and there will be projectile vomiting, and child is dehydrated, and child is not gaining the weight, and there is also visible peristalsis, and also there is projectile vomiting. Okay. Similarly, one more cause is gastroesophageal reflux. In case of gastroesophageal reflux, the presentation is a slightly bigger child and not a happy sphitter. That means he is regurgitating, but he is not happy. But child is irritable, and there's a body arching will be there. That's very important. Okay. See, whenever gastroesophageal reflux, the acidic contents are coming up, and there will be extreme burning pain. Now, a small kid, how can appreciate, or how can it can reflect this particular chest pain or burning type of pain, okay, in the chest area, epigastric area. So usually it arches the body, abnormal bending will be there, okay, abnormal bending will be there, so body arching will be there. So by means of abnormal bending backwards, it try to keep that contents downwards, okay, because contents are coming upwards, no, through the esophagus. So anyway it has to go down, so child make a natural attempt to keep that gastric content down in the downward direction, so therefore it will go for backward bending in the form of arching. Okay, so a child may also present with a cough and apnea sometime. Okay, sometime child may also present with cough and apnea, and throwing up or not gaining the weight. Child may not be gaining the weight also. So these are the presentations in a child who is coming with vomiting along with a gastroesophageal reflux. Okay, if these presentations are there, then adrenal efficiency, I told there will be a lot of signs: vomiting, then dehydration, fever, and not gaining the weight, visible peristalsis, etc. Now, if the child is having vomiting, the cause is inborn errors of metabolism. For example, galactosemia. Okay, inborn errors of there is a problem with the metabolism of the galactose. So an infant who comes with the vomiting, there is also vomiting. Okay, hypoglycemia and vomiting, these are very common in carbohydrate inborn errors of metabolism. So vomiting, because young infant which comes with the vomiting and repeated such attacks, that's the beauty of the metabolic disorders. Metabolic disorders, they appears, suddenly disappears and reappears after some time. Okay, they come in just like allergies. Okay, for the allergy there will be some triggering factors for but inborn errors of metabolism, same thing can occur if you take the same type of the food. Okay, if you avoid that type of food which does not contain galactose, that's a different issue. Now, young infant which comes with vomiting and repeated such attacks, so that's usually you have to suspect about inborn errors of metabolism. So when you keep the baby nil by mouth for 1 or 2 days, the problem solved. Again, once you again start with the routine food, again the problem start. This happens in case of inborn errors of metabolism. ठीक है, जब आप पूरा उसको वोमिटिंग हो गया, डायरिया हो गया, जो भी हो गया, तुरंत हॉस्पिटल लेके आ गए, उसको नील बाई माउथ करके हमने उसको आईवी फ्लूइड में रखा, तो कोई दिक्कत नहीं है, क्योंकि वो जो ट्रिगरिंग फूड उसको नहीं जा रहा है। घर जाने के बाद आप रूटीन फूड में चले गए, वापस होम मेड फूड में, तो वहाँ पे कुछ ऐसा उस फूड में ऐसा चीज़ था जो मेटाबॉलिज्म नहीं हो रहा है। ठीक है, सो दैट्स लीड्स टू द प्रॉब्लम। ओके, इफ यू कंटिन्यू विद द कॉजेस ऑफ वोमिटिंग नाउ फर्दर in the child, that means abhi humne dekha ki newborn, then we have seen the infant, then we have seen the younger child, and now come to the child. In children, the most common causes of vomiting are gastrointestinal. Okay, gastrointestinal, that is a gastroenteritis, which is most common in children, school going children, or 10 years, 12 years, etc. And intestinal obstruction, another important is intestinal obstruction. Another common cause of vomiting, that is intussusception. We have explained intussusception has to be a major concern during the weaning period also. Okay, and otherwise also this intussusception is common. GERD, gastroesophageal reflux disease, this can occur at any age. Then in older child, the most common cause of vomiting is UTI, urinary tract infection. Okay, so this is because of the parenteral this is because of the toxemia which is produced. It's called as parenteral vomiting. Okay, parenteral vomiting, that means a child is suffering from some bacterial pneumonia, child is suffering from bacterial UTI. Okay, as a result of that, there may be vomiting. We have seen in many conditions. This is that pyelonephritis is usually associated with the vomiting. Okay, similarly, UTI, then hepatitis, there will be vomiting. Yes, then appendicitis, there will be vomiting. Peritonitis, there will be vomiting. Okay, some of the other causes in child is the CNS infections, intracranial space occupying lesion. Okay, so that is also cause of the vomiting. Then decay, the diabetes ketoacidosis. Okay, child with the diabetes 1, DM1 may suffer with the vomiting. Okay, this is because of the production of the more and more ketone bodies. There may be vomiting. Then toxins and any other poisons, or sometimes vomiting is also psychological. Sometimes vomiting is also psychological, or sometimes it is habitual. Of course, there is a difference between functional and habitual vomiting and functional and habitual constipation that we will discuss later. If you see the older children, maybe after 10 years, then most common cause of vomiting in them is gastrointestinal problems like gastroenteritis, then maybe dysentery, or there may be hepatitis, and other infections like pharyngitis, UTI, etc., or CNS problems like raised intracranial pressure, migraine, cyclical vomiting. That's one condition. Again, we will see later cyclical vomiting, mostly related to some ketone bodies and all, metabolic. Okay. Now, if you look into the adolescence period, what are the common cause of vomiting? Adolescence period, persistent vomiting in adolescence is maybe because of appendicitis, provided with other signs. Then inflammatory bowel disease. This is quite common cause of vomiting in the adolescence period. Okay, so inflammatory bowel disease. Now, in such condition, you have to ask the weight gain. Okay, then growth failure, growth charts. Then there may be arthritis or joint symptoms, etc. So, inflammatory bowel disorders. These are the most common cause of vomiting when it is happening in the adolescence. And in the female, okay, female adolescent puberty girls, so usually adolescent girls, bulimia nervosa and anorexia nervosa. I think you know that anorexia nervosa is basically a psychological problem where a child is, that means the puberty adolescent girl is not at all eating with the preoccupied mindset that she will going to gain the weight. Okay, that's okay. But bulimia nervosa is that condition, she will eat, but after eating she will get a feeling that, oh, I have eaten too much, I will going to gain the weight. So forcefully she will omit. Okay, forcefully she will omit the things outside. So this is called as bulimia nervosa. And sometimes migraine, that is also common in the adolescent period. Migraine may lead to vomiting. Okay, so these are some of the causes of vomiting year wise. And if you look into some of the red flags of vomiting, so when you have to take the vomiting very serious. Okay, one is prolonged duration. Suppose vomiting is there, as I told earlier, in a newborn, in the neonate, vomiting is persisting for more than 12 hours, whereas in the 1 month later, after 10 days, if you look into vomiting persist for more than 24 hours. So like that, in the first slide itself, first class itself, I have explained the red flags. If there is a bilious vomiting, then it is F. Bilious vomiting means the bile is also coming. So therefore it has to be taken very seriously. Then if the vomiting is there without loose motions, okay, now if the vomiting is there followed by loose motion or diarrhea, that it suggests that this is a simple descending infection, descending viral infection or any of the bacterial infections. But if there is a vomiting without any loose motion, okay, so then it is not gastroenteritis. Okay, and some of the other causes are there, and we need to be careful. Now, if the vomiting is there with abdominal distension, is vomiting is there, but meantime there is also abdominal distension. Now, this may be because of intestinal obstruction, or vomiting is there with the visible peristalsis, intestinal obstruction, or vomiting is there with the distension of the abdomen, maybe electrolyte imbalance, okay, like potassium, etc. So that may be the cause. Then, if there is a blood in the vomiting, then it is always serious. Okay, except the maternal blood or blood in the vomiting is always serious. And even the blood in the stool is also vomiting associated with the blood in the stool, like intussusception, current jelly like material coming out, stool coming out, and that is also dangerous. Then vomiting which occurs in the early morning hours on awakening, that is always indicative of intracranial lesion or intracranial problems. Therefore, we have to be careful. Then vomiting which is progressive. So usually vomiting is not progressive. 1 or 2 bouts of vomiting will be there, or 2 or 3 times will be there, and later onwards usually the vomiting comes down. But no, if the vomiting is progressive, yes, then you have to think about it. Then associated symptoms, if it is there along with vomiting is there with the fever, vomiting is there with the headache, vomiting is there with the hematuria, like that, associated symptoms. Then vomiting associated with the dehydration. So that may be seen in many conditions. Okay, vomiting with the dehydration, metabolic syndromes may be associated, or it may be in the diabetes ketoacidosis like DM1 in children. Vomiting with the polyuria, so that is also very important. Okay, so now these are the red flags that you have to be careful. Otherwise, there is no need to worry much. Just wait and watch policy, and the vomiting will subside, self-limiting. Now, what is the take-home message? Take-home message is very simple. Evaluate the seriousness of the child and behavioral changes of the child, and also associated symptoms. So these are the three things. Whenever the child comes with the vomiting, you look into three important things. One is how you will go into seriousness, whether this vomiting is serious or not serious. When you see the behavioral change, along with the vomiting, whether the child is dull, child is sick looking, or child is confined to the bed. So behavioral changes, or child is irritable, okay, or child is delirium. So you look into this factor. Then look into associated symptoms, whether the vomiting is plain vomiting or it is associated with some other symptoms. So then these two things helps to assess the seriousness. If these two things are there, two factors are there, definitely vomiting is serious. And whenever the patient of vomiting comes, try to make a provisional diagnosis. What may be the cause? Whether it's from the GIT, whether it is from the esophagus, whether it's from the stomach, or if it is from the stomach, upper part of the stomach or lower part of the stomach, if it is from the intestine, whether it's the first part of the duodenum, second part of the duodenum. Okay, so like this, you try to make the microanatomy, find out the microanatomy. Okay, so now suppose the vomiting is there, that vomiting is the vomiting of the milk is there, that milk is not curdled, plain milk is coming. So definitely that means that vomiting, that milk is not reached the stomach at all. If at all it reaches the stomach, with the acid coming in contact, it would have been curdled, milk would have been curdled, but it is not happening here. It is not happening here. So that means cause, the place, anatomy of the vomiting is simply in the esophagus itself. Suppose the milk is curdled, then the anatomy of the vomiting is in the stomach. Okay, if the milk is same, the vomitus is mixed with the bile, then the anatomy is definitely near somewhere around the second part of the duodenum. So like that, you have to do some of the provisional diagnosis. If you are not able to make a diagnosis, suppose, ask yourself, does the child require to go to ICU, wards or home? Okay, that means suppose you are not, you can assess the seriousness of the child, but you are not making, not able to make a correct diagnosis, because things are like that, scattered. So at least now decide the seriousness of the child and decide whether this baby has to be treated in home or ward or in the ICU. So if the child is dehydrated, then we need to ask the child, and that means if suppose the child is dehydrated, we have to be always careful, because already child is dehydrated, we cannot take the risk. Okay, one more episode of the vomiting may completely collapse the child. Okay, therefore in such conditions, assessment of the dehydration is also important because of vomiting. And ask about the dryness of the mouth. Now this is very important. Ask about the dryness of the mouth and amount of the urine passed or tears while crying. This is very important. Suppose mother is telling, my child has passed 10 times, 15 times, and child is there in front of you and child is crying and the tears are coming. Okay, a lot of tear is coming. That suggests child is not much dehydrated as presented by the mother. Okay, mother may be exaggerating the things, but child is crying and not even the tears are coming. That suggests that child has definitely undergone the dehydration. There is no fluid inside the body. Okay, and look into the dryness of the mouth. These are some of the simple assessment methods. Okay, so ask about the dryness of the mouth and also amount of the urine passed. That's a very good indicator. Okay, how much the last 24 hours, last 12 hours, how much urine has been passed by the child. So that gives a very good indication of dehydration. Then look at the color of the vomitus. You just look at the color of the vomitus. That also gives so many clues. Suppose in the vomitus there is bloody vomiting. Definitely it is indicated something dangerous. It need to be investigated. Okay, or painless blood vomiting, again dangerous. Okay, esophageal varices, although quite uncommon in children, esophageal varices quite common. Maybe sometime the vomiting may be also seen in blood mixed vomiting may be also seen in gastritis. Okay, because of the gastritis also sometimes the streaks of the bloods are coming or drops of the bloods are coming. Now suppose if the child is having green color vomiting, So green color is always suggests the presence of the bile. Okay, bile. So definitely there is a intestinal obstruction distal to the second part of the duodenum, and as a result the bile is coming along with the vomitus. Or sometimes there may be some other cause of intestinal obstruction like malrotation of the intestine, etc. Now associated symptoms also helps many times. For example, hydrocephalus. Okay, in the hydrocephalus there is vomiting with the enlargement of the head or increasing head circumference. Okay, now urinary tract infection. Okay, the patient is also having burning micturition and all the time, and the patient is also having vomiting. So this is also one of the important associated symptoms. So like this, different things will going to help us. So this is about what we need to look for. Now suppose if there is a simple viral illness is there only for few days, while other illness there may be prolonged vomiting. Now suppose if the child is having viral illness, first started with the upper respiratory tract, then going to the lower respiratory tract, then going to the GIT, like that. So there will be fever for a few days, and this fever for 1 or 2 days will be followed by vomiting, and after the vomiting, gradually the vomiting also subside and diarrhea usually start with some of the abdominal symptoms. Okay, so this is usually suggestive of a descending viral infection. In descending viral infection, what happens is when vomiting starts, fever subside. Descending viral infection. Okay, initially there will be fever, but when vomiting start, fever subside. When diarrhea start, vomiting subside. Okay, so this particular pattern is clearly suggestive of a descending viral infection. Okay, then if there is a prolonged vomiting, suppose if there is a prolonged vomiting, then we have to be careful. It is not the routine descending viral infection. ओके ये जो पैटर्न को फॉलो नहीं कर रहा है, फीवर भी है, उसके साथ वोमिटिंग भी है, और ये दोनों के साथ अभी डायरिया भी शुरू हो गया. So persistent vomiting is there, then it is not actually the descending viral infection. Another is vomiting is there, and whether this vomiting is related to the feeding time, that is also very important. Suppose child is vomiting every time during the feeding only, otherwise child is normal. So mother is sometime may be forcefully feeding and it leads to some aspirations, and because of that vomiting may be there. Okay, therefore timing of vomiting is also very important, whether it's during the night hours, in the morning hours, or during the time of the feed, or during the time of sleeping. So these things are very important. Okay, now if it is immediately after feed, there may be problem in the stomach. So if it is after 2 hours, problem may be in the pancreas. Now suppose immediately after feeding, the chance of aspiration is there, there may be vomiting. So sometime after feeding, there may be some problem in the stomach or esophagus, therefore there will be vomiting. Okay, now if the vomiting is happening after 2 hours, 2 hours means it passed through the stomach, entered into the intestine, and goes through the pancreatic area. Now if it's happening after 2 hours, so then there may be some problems related to the pancreas also. It may be cystic fibrosis or some other pancreatitis like conditions, A-beta glutonemia, like many conditions are there. So these are some of the common things. Now next part we will go for the physical examination in a child with the vomiting.